Good afternoon, everyone. We're going to get started in just a few minutes. Right, let's go ahead and get started. So good afternoon, everyone. My name is Emma Guile, and I am the co-chair of Advocacy and Policy for the Women in Global Health Georgia chapter, and I'm delighted to welcome you to this event today with two of Georgia State's representatives, and we will be having a discussion on caregiving policy and advocacy in the state of Georgia. But first, I would like to discuss a little bit about our organization. Women in Global Health Georgia brings together women across the Southern United States and in particular in Georgia, to advocate for gender equality and to bolster women's leadership in the field of global health. Our chapter is part of a broader global health network of women in global health chapters who are all committed to doing this type of work around the world. One of the ways our chapter does this is through advocacy. And so based on our feedback from our membership, our advocacy priority for this year is related to caregiving and how the roles and expectations of women to care for children, family members, and elderly parents impact women in the global health workforce and gender equity in leadership. So this also includes policies in the workplace, but also at various levels of government, which is why we are so excited today to have this event to dive deeper into Georgia state policy related to this issue. So in addition to advocacy, our chapter is a way for women to network across the global health field in our region and also to strengthen leadership skills. So if anyone is interested in joining Women in Global Health or interested in having a leadership role on our leadership team, you can sign up, and I'll put a link in the chat. Please put any questions you have in the Q&A chat as well as we move forward through this discussion. And now I'm going to hand it over to Andy Tucker, who is our chapter's chair for communications and our moderator for today's event, to begin our discussion and introduce our panelists. Thank you so much.
Thank you, Emma. Hi, my name is Andy Tucker. I am the comms chair for Women in Global Health Georgia, and I work at the Task Force for Global Health in Decatur, Georgia. Really happy to be here with you all to have this conversation today about caregiving policy, and specifically today about childcare policy. Access to affordable, reliable childcare is just so critical, right, for enabling women's participation in the workforce, supporting children and families. So we're really grateful that we're going to get to connect today with two leaders from the Georgia House of Representatives, Representative Lisa Campbell and Representative Saira Draper, to learn about legislative efforts in this area to address this challenge. So first, we're going to speak with our representative colleagues that are here, and then we're going to move into a brief audience Q&A at the end. So as questions bubble up as we're speaking, I would encourage you to put them in the Q&A, click on the Q&A box and drop your questions in there so we can address them at the end of our conversation. I always think it's fun to start with a story, so I'll share a very brief one. Which is I have a toddler. I have an almost 2-year-old at home. And while we had the planning call for this conversation, it was about 2 weeks ago on a Friday morning. And typically my husband watches my toddler on Friday mornings. But this morning he had to go to the dentist. So I was standing in our living room trying to keep the 2-year-old entertained. And the only thing that would entertain him while I was on this phone call was the Sesame Street soundtrack playing at full blast and the world's most annoying train toy. It's like very large and very plastic and lights up and makes a million sounds. So every time I needed to say something, I was having to step into the hall bathroom to say it very quickly and then step back into the living room to keep an eye on him. And it was just so emblematic of the experience of being a caregiver and working, and made me really grateful for the childcare that I do have the majority of the time. But it was like, wow, this is relatable. This is just a moment that every working parent has had, juggling these two things at once that are sometimes butting heads, so critical. It's just so critical to have access to accessible, reliable childcare. So we're really glad that y'all are here and that we're getting to have this discussion today. So first, I'd love for you to introduce yourselves, if you would. Can we start with you, Representative Campbell?
Love that story. And I think everyone on this panel and all the caregivers in Georgia can relate and so much. It's so wonderful to be here. Thank you so much for hosting this, for teeing up these really important conversations. My name is Lisa Campbell. I am just ending my first term as a state House representative. I represent the District 35, which is North Cobb, so Metro Atlanta. Think about the communities of Kennesaw, KSU, Ackworth, and Marietta. And it has been a thrilling 2 years, and I'm super excited to have been reelected. And childcare, early learning, education, healthcare are, in addition to women's rights, the top priority platforms that I've been running on, and that the people in our community elected me to return to work on in terms of rights, resources, and opportunities for our parents and for our childcare providers, as well as for all of our caregivers, for seniors, but also family members who have needs. So thank you so much.
Yeah, thank you for being here with us. Representative Draper?
Yes. Good afternoon, everybody. My name is Saira Draper. I am the state representative for House District 90, which is in DeKalb County, covers portions of the city of Atlanta, Morningside, Virginia Highlands, Candler Park, Lake Claire, Kirkwood, Edgewood, East Atlanta, and also some of unincorporated DeKalb, like parts of Druid Hills, Cedar Grove, Conley, Ellenwood, Gresham Park, and Panthersville. So it's a wonderful district in the heart of Metro Atlanta. I am thrilled to be a part of this conversation, because conversations like this is how we make change. It is the very necessary step to how we make change. Relevant to this conversation, I am a mom of 3 small children. I have a 9-year-old and a 7-year-old and a 4-year-old. The 4-year-old was born, in the middle of the pandemic, and I have so many stories about being on, a working mom, where I was constantly doing this with my screen, y'all. I was moving it up and down, because when I was breastfeeding, my screen was like this. And when I wasn't breastfeeding, my screen was like this. And I had so many comments from folks, like, wow, that was really cool that you just kind of went with it. And I was like, what else was I supposed to do, right? You're still a mom, you're still working, and all the things collided. So I think, representation is so important at the legislature. And when you look at the wonderful, well, that might be too generous, the colleagues I have in the House of Representatives, look, there's a lot of people who either haven't been in that position or are a long time from that situation. And Andy, as you were telling your story, even I'm just a couple years from having toddlers who literally need their parents to do every single thing from them. And I think that when you're in that phase of life, it is such a haze. And once you get through it, once you have a little bit of room to breathe and you can start thinking about other things, sometimes we easily forget. So having this conversation and talking about the real challenges associated with being a caregiver, whether it's for small children, whether it's for aging parents, is absolutely necessary. And it is the way that we push policy solutions forward. So really looking forward to this conversation.
That's great. Thanks so much. So my hope for this conversation is that we'll be able to explore, some of the challenges around policy related to caregiving, talk about some actionable solutions and how we as Women in Global Health, we as folks that care about this issue can collectively support caregiving policy in Georgia. So I have a handful of questions. I'd love for this to be kind of a free-flowing conversation, so I'll throw them out. And to the representatives, please feel free to jump in with whatever you'd like to share. And then I will open the floor at the end to make sure that there are topics that you want to be covered, that you have the space to share those. So let me kick off with a broad question. What are key caregiving related pieces of legislation that are being considered in Georgia? What are you interested in? What are you following? What are you passionate about as it's relative to key pieces of policy? And how do you see these supporting families and caregivers?
I'm happy to jump in and just kind of piggybacking off of your comment, Saira, that representation really is critical. I was the first woman ever to be elected in this district along the same lines. And so really being able to show up and say, yes, this is the experience as caregivers. I don't have small children, but I am actively a caregiver for my aging parents, and so have we've just been hearing a lot about the sandwich generation, of which I am a part of, and so I think being able to show up and have these real world experiences ourselves, but also that folks in our communities can now feel very comfortable sharing that these are really important day-to-day issues. So I was so excited to be the proud sponsor of a bill in my very first term that I'll be bringing back in a very robust and expanded way. And it was a piece of legislation called Georgia Children's First Trust Fund. And this was a bill that was designed to really address a growing need that we have in terms of statewide investment in childcare and early learning. So Georgia's had about a 30-year history, started with Governor Nathan Deal and his wife, and they were very interested in understanding how do we as a state collectively contribute to the well-being of our youngest children. You're all the experts, but we all know that brain development between 0 and 3 is the most dramatic and dynamic of our lifetimes. And I think that is so profound that everything else that we hope for ourselves, for our children, for our communities, for our workers, for our business owners, really stems from what happens between 0 to 3. But then if you look at that at the policy level and at the state budget level, we do not have very many dollars allocated specifically to care for our youngest. So to me, this is a massive gap and really building on a crisis. Right now, we're looking at so many outcomes that are a direct result of not having invested in early learning and childcare. So we're looking at, I was on the Literacy Council call yesterday, plummeting literacy rates, reading, math, mental health issues. All of these could very easily, we're not guessing, be tracked back directly to this gap in childcare. We know now that more than 70% of Georgia's parents work outside of the home. So we have this huge group of children, hundreds of thousands of children, that need very specialized care in the most important development phases of their life. What are we doing to support our families? And so the trust fund idea is a new idea. And the idea was to take, you might have heard that right now in Georgia, we have $16 billion of our tax dollars that is collected from us and supposed to be delivering services for us. But right now they're just sitting there. And so this idea was to take a portion of those funds. This year I'll be recommending $7 billion and put those into a trust fund. This would not be to supplant annual budgeting. I think we still need to increase the actual dollars that are going into investing in childcare, but it would supplement it. And the idea would be that over time, this would be a self-funding investment opportunity, and we would take the returns from these funds every year and direct them over to our Department of Early Learning and Childcare, to DECAL. So we currently have a program called CAPS, which is Child and Parent Services. And right now that program is doing some really good work. It's just not reaching very many families. And so the short-term goal of the trust fund would be to immediately be able to help those families who are at the lowest income levels, who need the most help with child care, be able to cover the cost of childcare. And the other kind of crisis element that I'm talking about, and then I'll pause, is that the cost of childcare is exorbitant. I have not walked into a room in the last 2 years where talk about the average cost of childcare, which is about between $7,000 and $10,000 a year per child, where I didn't have everyone in the room raise their hand and say, oh my gosh, you've got to up that number. It's significantly more than that. It's sometimes more than my mortgage payment. It's more than saving for college education. So the short-term goal is help those who need it most get care. And then the long-term goal, which I think is the really big idea that I want to keep exploring, which is what would it look like if we as a state decided that we wanted to invest in early learning in the same way that we've decided there's a great return on public education K through 12? What if it is universally paid for and available for all families? This happens in other parts of the world. And all of the economists will say, not just the childcare experts, the financial economists will say the financial return on that is exponentially more than maybe any other investment that we could make in our state. So Child Care Trust Fund, it's a big number. It's a start in just the first phase of potentially helping families afford the cost of childcare. And then also, some of those funds would be used to help childcare providers. So that's a whole other topic of conversation that we can get into a little bit more about what resources are needed to start up facilities, to train teachers, to make sure that this is a valued profession and role, and that we have the resources that we need to support that.
Yeah.
So that's one piece of legislation.
Yeah, wonderful. Thank you for highlighting that. That touches so many topics in this issue. So that was really great. Thanks for elevating that. Representative Draper, is there anything you'd like to jump in with?
Well, I know Lisa's taking a pause so that I can come in here, and I'm so excited about the ideas she has about this area, in particular, because she is taking such a holistic view. And I could not agree more that this is something that needs, major reform. It's not enough to just do a little bit here and do a little bit there. I think the system is fundamentally flawed. And I think that, this is a very appropriate area in which government should be involved. Because if you get back to the caretaker issue, and the folks who work in the childcare industry, they are paid so little to do this massively important job, a job that frankly I could never do. I would never be able to do it, right? I can barely keep up with my own kids, much less a classroom of 10, 20, whatever it is. And when you look at how the finances break down, they're being paid so little, and yet it is so hard to have a daycare because the liabilities are so high, the insurance is so high, so the costs are just exorbitant. So of course that cost is being passed on to the consumer, and yet the people that tend for our children are being paid so little. So it doesn't make sense. It doesn't make sense. And that's why in other countries they've had major, government intervention and subsidies. And I think that's something we need to look into now because the numbers don't number otherwise. And, it is, I think a lot about how what economic rung you are dictates policymaking in the legislature. Obviously, people who have more influence are able to afford lobbyists, are able to put money behind their issues. I mean, those are truly the issues that move forward. And look, there's a lot of folks who are well-to-do that don't have the same challenges with childcare. They're able to afford their childcare, so this is not a really important issue for them. And I think that's a lot of the reason that these issues haven't been given more attention. But at the end of the day, to Lisa's point, an investment in 0 through 5 would have so many benefits down the road to Georgia as a whole and be cheaper to Georgia as a whole when we don't have to do, supplemental education, or, subsidized, in the workforce when people can't find work. So
Yeah.
I think there's a lot of benefits there, but we have to compete with all the ideas that have lots and lots of money behind them. So that is the challenge. And I hope we can talk a little bit more about that. How do we get over that challenge?
Yeah,
absolutely.
I would just piggyback on that and say when I brought forward the bill in the last session and that number, I got a lot of sort of, scoffs. Ha, good luck, right? And, sort of this surprise. Why would we ever consider, right, that level of investment? But you look every year, we've got billions of dollars going to roads and transportation infrastructure, as just an example, or our technology grid. And there's not a blink of an eye. Like, of course, that's going to benefit us. We need those things. And so I think just really being able to shift that conversation, to your point, Saira, to say, no, if we really, this has so many long tail and intertwined connections to workforce. Right now, so many conversations that we walk into are about workforce shortage, workforce shortage. Well, guess what? One of the key barriers to workforce entry is lack of affordable childcare. And some of the estimates are in, I think I saw $1.75 billion that would be returned to the economy in 1 year.
Wow.
If more parents who had access to affordable health care could go and work. And so, again, the impact of that just bubbles up. I hate the expression trickle down. It doesn't work. But I do think there's an opportunity and a real proven science here to say this really will bubble up, right? So there's the economic opportunity for the workers in our communities, but there's also then the future economic opportunity of students, learners, children who are well prepared before they get to pre-K and go on. There's study after study to show that our reading rates go up, our literacy rates go up, our graduation rates go up, our college and career readiness rates go up, higher compensation levels, more stable relationships, greater contributions to our communities, all the things that we want over here in the business side of the house, if you will. And so it's dual fold in that way in terms of the contributions back to our economy.
And we're talking to a global health crowd. I bet you guys don't need a lot of
Right.
convincing on this one, right?
Well, I'll say what you're highlighting here is a classic challenge that we face every day in our work as public health practitioners, which is we know the long-term benefits. They're huge. I mean, they can be unbelievable, right? Like, so coming from the task force, one of our founders always used to say, to eliminate a disease, to eradicate a disease, those very last efforts are really costly. But after that, it's nothing. The return on investment is infinite, right? Because we don't have to spend money on smallpox anymore. Right? And you can make the same kind of an argument here, right? Is that when we make these early investments at a small level compared to what they can generate long term, we're looking at huge benefits for society. What I want to ask is a challenge that we run into is then, how do you draw people to the now? How do you highlight the short-term gains? Because we know the long-term gains are massive, right? But sometimes people want to know what's going to happen next year so that they can point to, look at what I did, or, so that they can get past this funding cycle, or, sometimes the wins need to be shorter term. So as we're thinking about, I liked Representative Campbell that you were talking about this approach and that you see it having real long-term implications, but that you also see some kind of low-hanging fruit for the near term. What are you thinking about in terms of near-term wins in advancing childcare policy?
Well, I think through additional funding allocation, so increased wages and benefits for early childcare educators, so that right now we have a shortage of childcare workers. As Saira mentioned, Georgia ranks number 50, literally at the bottom in terms of the salaries. So an additional investment could help recruit folks to say, hey, yes, this is something that we're going to value. And yes, you can invest in an education here, in the certification and the training, and feel good about this job and pay your own bills. There could be expanded training opportunities with additional investments. So we could have scholarships or loan forgiveness for folks who choose to go into childcare or early education. We could have sort of a tiered approach. So we could have more dollars going to interventions and incentives for those families with the highest need. There's also some other things that could would be related. Things like right now, our Medicaid population. So we've had a huge reduction in the number of families that have been eligible for health care coverage. And one of those reasons is that Georgia is the only state right now that has a work requirement for health care coverage under Medicaid. And one of the opportunities for change could be changing the policy so that caregiving is considered work. And what that could mean is that then young mothers could say, yes, I work 80 hours, I think is the requirement, and I'm caring for my newborn, or a family member who's caring for maybe a child with a disability or caring for an aging parent would also qualify. Well, that's tremendous because now they have access to healthcare resources, physical healthcare resources, mental healthcare resources, and they can get that coverage. So again, that bubble up effect of reducing the compound harm of lack of access to healthcare. Again, other things that could be happening would be going, the people being able to go back into the workforce. So not just literally I can take a job, but with reliable, affordable health care. Now I'm more likely, the stats show, to have less absenteeism. I can be more productive because I'm not worried, because I'm affording quality childcare that I can trust. And so again, there's that bubble up in terms of increased productivity for small businesses, for large businesses. It really goes across all of our different economic areas in that way. I think there could also be interesting ties to, we have folks in our government leadership who really boast that Georgia is #1 for business, right? Great, we need good businesses. We all want good businesses, right? To fuel our jobs so we can have meaningful careers, et cetera. Well, what if some of our billion-dollar tax abatements incentives that we offer these businesses to come here are dependent on what are these companies going to be doing to contribute back in terms of literal childcare investments? Will they be willing to build an on-site childcare facility for their employees? Will they be willing to partner with our local school systems and contribute money to the development of childcare facilities? We know childcare doesn't necessarily 0 to 5 look exactly like public education as we know it today. Smaller groups, a network of different systems. I think there's a lot of opportunity for innovation there that again will have mutual reciprocal benefits. It'll be good for the children, be good for the parents, but it'll also create literally new jobs in the communities as well. And especially if they're higher, more well-compensated jobs, they'll be more meaningful. And again, more workers means that now I can go and I can maybe buy a house in this community, stimulating the economy. I can buy more essential items for my family. So it's really not a vicious circle. It's one of those golden circles that just keeps giving and giving and giving. So I think there's so many tentacles to this investment in the short term, immediately.
Yeah, absolutely. Yeah, there were so many interesting things that you just shared there. One that really stood out to me was compensating childcare providers, family members, mothers, fathers, whoever, right? But acknowledging that can be, we know that women tend to provide more childcare than men do. And so I think as a move toward equality, toward recognizing women's work as work, as labor that deserves to be compensated, that's a really interesting idea to me. That's wonderful. Thank you. Saira, can I ask you to jump in? Is there anything you'd like to respond to or share?
Just that I think it's so important when we're strategizing over how to push these policies forward. It's so important to frame these things as pro-business and stimulating the economy, because sometimes that seems to be the only language that the decision makers and the legislature seem to understand. And I'd love to talk a little bit about, how to push some of these through and how to give these things more attention, because it's not rocket science, but if you've never done it before, you wouldn't know where to start. And I see a lot of well-meaning citizens come to the Capitol and, pull their representative aside and say, hi, I support this issue. And that's wonderful. And by the way, if you're my constituent, you call me to the ropes and you say, I support this issue, I'll say, yes, I do too. And that's great. And that's great. And then, hopefully we'll talk more about how we can move things forward, but there needs to be a strategy and there needs to be a pressure campaign to actually move bills forward. And unfortunately, well, look, this is the lay of the land. There's one party in power in Georgia at the state level. So just starting at the very beginning, most of these policies are going to come from state level policy changes. Sure, there's some, levers at the federal level, although probably less moving forward, and there's levers at the local level, but most of these big decisions, most of these big opportunities for change are coming from the state level. The state level is powered by one political party. And what that means effectively is that political party assigns the chairpersons for all of the committees in the legislature. The committees are where a certain bill, Lisa's bill, let's take Lisa's bill.
Let's take it. Let's move it.
Let's move your bill, Lisa. It's going to get assigned to a committee. And that committee is going to be chaired by a Republican chairperson. And so the first step of moving something forward is having a pressure campaign to that chairperson saying, we really like Lisa's bills for XYZ. This is my expertise. This is why it's going to move forward. Let's frame it in terms of the economy. Let's frame it in terms of jobs. And I would like to see this move forward. Extra points if you actually belong to that chairperson's constituent. To that chairperson's district, because they're going to listen more to you if you're from their district than if you're not from their district. So maybe part of the campaign is getting people from that chairperson district to take our talking points and bring them to the chairperson. Those chair people have absolute discretion over whether they will allow Lisa's bill to be heard or not. And even if it gets heard, it may not receive a vote. But let's say we get it to the point that it receives a committee hearing and potentially a vote. Well, then we have to go the extra step and talk to all the committee members, right? And this is why we support Lisa's bill. And by the way, we've got lots of people from your district who think this is an important issue, and let us tell you why. So, those are just the first steps, but I think it's important. And I'd love to invite all of you to come to the legislature during the session. We start on January 13th. And if you haven't been there before, I love to show people democracy in action, because it's a wild world out there. I mean, it is such a it's such a place of its own, where you have to kind of know the rules and the levers of power. And Lisa and I want to work with you on that, because that is how we're going to move policy forward.
Yeah, that's wonderful. And I'm so glad that you took the conversation there. A hope of mine for this discussion is that there would be some demystifying the process, because it can be really impenetrable for somebody that doesn't have a lot of experience with it. And we know that I think we know when we hear that the state level is so critically important, but so much of the focus, the media attention is targeted at the national level, of course. And so finding those entry points, I think, at the state level is so critically important. So if you don't mind, let's just take that discussion just a step further and say, so what would it look like for members of, Women in Global Health Georgia during the next session? Because we planned this discussion now, looking toward the next session. What would it look like for us to support this particular bill, for example? What could we do?
Well, another part, I think, of demystifying the work that Georgia state legislators do is to understand a little bit about our teams. Georgia legislators are considered part-time legislators, and there is a very small salary that goes along with that. Most of us have other jobs, full-time jobs, in addition to our caregiving roles. And what that means in terms of support is that providing policy research, data, statistics, I know we may talk about that a little bit more, is tremendously helpful. If that can be localized, again, to Saira's point, if we can call out specifically in a district, like I've done in Cobb, how many families are impacted, how many children, and really bring that home, and then identify, as she said, constituents literally in the district where the chair comes from, or the committee members, to talk about their experiences. That it can be very, very powerful. In my opinion, that dual combo of like, these are the stats and they're staggering, right? And that is a really compelling story, helping us pull those stats, helping us make sure that those stats are really credible, and that we have great experts helping us with data visualization, so that people really in an instant really understand the gravity of the situation. But then also combined with those really personal human stories, because that's why you opened, right, with your personal story, because that's how we motivate people to change or to take an action. That's how we persuade them, right? We like to think, and you're the scientist to affirm or not, but that we make these rational decisions based on all of our data and input. But ultimately, many of our decisions are based on our feeling, how we feel about this and how it impacts us on an emotional day-to-day level. So I think just again, organizing around a strategy. What are your goals? Writing those down, sharing with the legislators, and then, yes, making a plan to be there at the Capitol frequently. And then as bills are assigned, supporting those bills, again, all the things that Saira mentioned. And then if the bill does get a hearing, that is a really important opportunity to show up and have a strategic approach about who speaks, signs up to testify. And just really thoughtful things like let's make sure that we have geographic representation, not all from Metro Atlanta. And it's really hard sometimes to do that because if you're a caregiver and a worker and you're living in Valdosta, right, it's not easy to come up and maybe your committee hearing. Often the times are not set in stone. It's going to be today. It may be at 2:00. Oh, guess what? It's now at 4:00. So I think, advancing all of these things not in a silo is really critical. Making sure you have, a backup plan and backup people to be there in person and then virtually. Making sure that we have great representation for all walks of life. So, all genders, all ethnicities, all races, all economic backgrounds is really critical as well when we show up to talk about why and how this matters to a large majority of people in Georgia. And I think it doesn't happen on a single day. And that's the most difficult part. It happens every day of the legislative session, just consistent showing up, so that it can't be denied, basically. So that there's real pressure on the legislators to do something, to take an action. Another part of that strategy is a media strategy, right? We talked about how do people get information. So working together with, an open invitation to work together with our caucus to make sure that we're inviting the journalists and the journalists for traditional news sources, but all those other, podcasts and bloggers and influencers out there who also are able to reach people and get a real grassroots movement going. And that's how most major changes happen, is with a grassroots initiative. Yes, we hope that have been elected. That's one area and one way, a mechanism, but we need all of it to really be successful.
I'd love to just mention two initiatives that have been successful in my eyes, although we haven't seen the policy changes that we want to see yet, but they have gotten a ton of attention and we're on our way to making policy change. And they're both very different, but both very effective in my view. One is an effort for more gun safety reform. And what a group of emergency pediatric doctors have done at great personal expense and sacrifice because they are spending hours away from their families and hours away from their jobs. And I realize, the tension that has with us all being caregivers, of course. But what they have done is they show up at the Capitol every single day of the legislative session, which is 40 days. They're in their white coats. They have signs about, ask me about gun safety. And as the legislators are, roaming the halls, going into session, going out of session, they're trying to have conversations with every single one. But just their presence in the Capitol every single day in those white coats, I mean, it really is remarkable, and I haven't seen another effort like it. The other effort that I wanted to share is one to protect the Okefenokee Swamp. And those folks have taken a very different tact. Theirs has mostly been one of volume via email. So they have gotten a ton of people to send emails to all of the elected officials about that issue. But what I've been most impressed by is how the message is so nimble. So on one day, it's we would like you to support this bill. When they meet their intermediary goal, now the message has changed and they say, okay, we have, we want you to push for a committee hearing on this. And then the message changes. Okay, they're not giving us a committee hearing. So we would like to get 90 people to sign on to this bill, in which case we can pass the committee process. So their messaging has changed. It's been very nuanced. It's been very directive. And to Lisa's point, it has gotten the media very interested. It has caused a lot of kerfuffles between, the folks on the in the Republican Party who have a lot of folks for it and a lot of folks against it. So it's really forcing the issue. And although we haven't seen a legislative success on that issue at the state level just yet, it did spur action on the federal level. that we are seeing now. So there's a lot of ways to get the results that we want, but we have to have the pressure, we have to have the attention.
That's
Great.
wonderful. Yeah. Thank you for sharing those examples. Yeah, Lisa?
I was just going to say two other things that kind of came to mind as you were talking about it, tools that those organizations use. So online toolkits, so harnessing technology, right, to allow other people to, not everyone has access to a graphic designer. Not everyone knows how to draft a press release or put together content for their own Twitter feed. So just creating those types of shareable assets really helps also get folks who are care, but are super busy or don't know how necessarily to do things. Just give them the instructions, make it open, and allow social media to do what it does best, which is amplify stories. And this is good content. So, and sometimes there's some hesitation, right? I don't know if I want everyone amplifying it, but that's where I think there's an opportunity if you have an organized strategy and you have some assets that people can use those, but also attach their own personal story to it, which making it even more relevant. And I'm looking, you may be looking in the chat over here too. I don't know if you want to get to those now or later, but some of the questions have been about blueprints for how to move childcare forward. Right now, there are a few states, our policy team, I kind of was going in this direction as well. So most state house legislators don't have a full-time staff. We certainly don't have a staff that's paid for by the government. Any staff that we have working for us are either volunteers or we pay for out of our campaign funds. Most people don't know that. So demystifying that a little bit. So volunteering your expertise to help in that capacity is also very useful. But one of the things we are doing is looking at exactly that. What are other states doing? And there are some really interesting ideas that we've found so far, things like for childcare workers themselves, offering scholarships to childcare workers so that their children, the cost of their childcare work is covered 100%. So again, kind of dual incentive there to go into the industry, hopefully because you're going to be getting maybe your education and paid for, you're going to be making a little bit more money or a lot more money for the valuable services that you're getting, but also you're going to get the benefit of having your own children's care covered. So that was a really exciting idea that we've been taking a look at. As well as scholarships, incentives. Somebody had asked about the educational programs here in Georgia. There are many, but again, thinking about money that's earmarked for scholarships or grants or programs where if you agree to work in the state of Georgia, as an example, for maybe 2 to 5 years after your education, maybe you could get all of your education paid for in terms of loan forgiveness. So some really interesting programs there that absolutely we are looking at that will be a part of that larger childcare early learning package that I kind of kicked off with.
Yeah, that's great. Thank you. I have one more question that I'll pose, and then I'll turn it to more of the audience questions. I know a lot have been coming in, and we could do this for hours and hours, and I would love that. But let me just say, as public health practitioners, we understand the importance of data. A lot of us work with data all day long. That's a huge part of the work that we do, is trying to understand the problem so that we know the appropriate solutions to address it, right? So would love to talk about feedback loops, data collection, how data can support caregiving policy, and many of us work in projects that generate data related to women and children. So would just love to hear more about kind of the feedback mechanism, how we can turn data into good policy, and what that chain looks like.
Well, this is an area, given my professional background in terms of data, our entire system of governing could use a pretty massive modernization effort. So data in and of itself is a need and is a gap here in Georgia. Some of the first budget hearing meetings that I went to, I remember hearing things like, well, this is a one-time expenditure of $200,000 for our new data collection website. And I just, cringed because any budget that in our state today that doesn't have a recurring annual investment in technology is doomed. It's just truly doomed. We're never going to be able to keep up with the pace of our society that we live in, much less be able to be efficient in delivering the services. So without that, the mechanism for actually gathering the data is really restrained. And so I think elevating that conversation about investment of data collection. So at the Department of Education, at the Department of Health, through DECAL, again, we have sort of these a dual need for advocacy. The budget right now has already been prepared and presented from every state department, every department in the state to the governor. The governor has asked this year no increases. So what do we do about that? When we know we have these huge gaps, many families underserved, a dearth of investment in technology. So that's an advocacy effort as well to say, in order to get to that data that we need, where can we invest in public-private partnerships? Where do we need to invest in the expertise in-house to make sure that we're building out these systems to care and to get that data? And then transparency. We do have a lot of data, but it is not always, it's typically, unfortunately, in the state of Georgia, not shared directly with the public in a dashboard that's easy to use. Often people must, policy advocates, even legislators, rely on, FOIA requests. Well, that is not helping our process, right, of understanding what the real problem is, much less developing an innovative solution that is rooted in data and evidence. So again, advocating for dashboards, advocating for direct access. President Obama, when he was in office, that was one of his biggest missions, which is an Office of Transparency and Accountability. And the whole reason for that was to engage the public in what we're doing in terms of governing. And I think I'm so pleased to be a part of the Democratic caucus because that's what we want and that's what we need. We need everyday Georgians in their expert roles, in their citizen roles, to be a part of the collaboration, the work of governing. And it's difficult to do that when a lot of the policies are designed to divide us and to hide the information. And so advocating, we need more of that. I wish there was a lot more to share in terms of what we had on the horizon, but we're behind in this space. And so advocacy there as well is really needed, I think.
Yeah, that makes perfect sense. Thank you for that. Representative Draper, do you have anything you'd like to add?
If I wasn't already elected, I think Lisa might have just encouraged me to run for office.
Okay, that's right. Also run for office at every level of government.
Great. Well, I'd love to turn it to some audience questions, but before I do that, let me just open the floor one more time to both of you to share any other things that may have surfaced as we spoke, any other points that you'd like to highlight before we address some questions.
I'm just looking at the chat. There's this question about moving forward on elder care. I don't know of anything. Do you, Lisa?
Well, I am also on the Human Relations and Aging Committee. So yes, there are some really interesting things that are coming up there, and I think it deserves equal attention from us as legislators. In fact, the senior population is going to be significantly more so in the coming decades than any other age group. So one of the programs that we advanced last year was a program called PACE. And this is a trial program, and this has been around in the rest of the country for about 20 years. It's a proven way to deliver much needed services for seniors at home. And so there are 3 markets in Georgia right now that are trialing this and get Medicare coverage for those services. So again, economically, it saves a tremendous amount of money. It's very expensive, institutionalized care, as I'm sure this audience knows and understands. And most Georgians would, for all the obvious reasons, prefer to stay in their homes. So having access to Medicare coverage in your home is going to go a long way to making that kind of care available to more people. And I hope that in this committee, we'll be looking at data and results about how effective that has been, how many families have participated, what that looks like as a network of care. And I would love to see that rolled out on a much larger scale and mirrored in smaller ways across all of our different communities. It included expanded access to telehealth as well, and a lot of transportation related issues. So to me, sometimes we get really narrowly siloed in these committees and we're just looking at seemingly one element, but a lot of these things are super related. So if we don't have good technology in rural communities in terms of broadband access, then telehealth or virtual health becomes an impossibility. Those things go together. If we don't have great transportation options for our seniors, like mass transportation or new sort of innovations in terms of micro transit systems. And our seniors can't drive anymore, and they don't have access to healthcare providers. There are a lot of, to me, just looking at all the barriers to connect the dots between ideologically, what do we want to achieve, and then legislatively, what's required. So many other things in terms of senior care. I think the Medicaid expansion question,
A big one.
it's a huge question. I do think there probably could be more traction with changing the Medicaid eligibility to allow caregiving as a work requirement. Could be a first step that could help a lot of families get that care before there's a Medicaid expansion, which of course I support wholeheartedly. Should happen immediately. It's the right thing to do for our people and for our budget.
We almost got to Medicaid expansion last year. It was on the table, it was off the table, then it was on the table, and then finally at the last minute, there was about to be a Senate vote to move forward a Medicaid expansion bill, and word is the governor called and killed it at the very last moment. So much so that some senators stepped out of the room when the meeting was supposed to start, took the phone call, came back in, voted no when they had said they were going to vote yes. So we got incredibly close. The widely reported was that the reason Kemp stopped it was because he has an alternative to Medicaid expansion called the Pathways Program that costs more to cover less people. And he wanted more time to see if it could work before moving in the direction of Medicaid expansion. That's frustrating, I'm sure, to a lot of folks on this call who have seen Medicaid expansion and how it has worked in other states. I mean, we are one of, I think, 14, maybe even less states at this point that hasn't expanded Medicaid. But the conversation was more robust last year than it has been in a long time. So the question is, whether it's going to move forward next year really does depend to a large extent on how the governor feels about it. He has been against it. He has wanted to give his, as I said, the Pathways program an opportunity to deliver. It hasn't delivered yet. I don't know if that's going to enter his calculus as he decides whether or not to, agree to let it go forward or not. The Lieutenant Governor, Burt Jones, has expressed, some interest in considering it this year, which I think is interesting. So, of course, as politicians, we think a lot about policy, but we think a lot about politics too. Lieutenant Governor Jones is widely believed to want to be running for governor next year. So, it wouldn't be shocking to move something forward like Medicaid expansion if that's something he can run off of, in a couple years. So maybe it doesn't happen this year, maybe it happens next year right before he runs for governor. But, unfortunately, Medicaid expansion is one of the issues that has been wildly hung up in politics as opposed to good policy, which is why it is where it is now. So that was a very long way of saying, Sarah, that we don't know, but we're hopeful.
Yeah.
No, thank you. That was really helpful context. And we've been able to cover some of the other questions in the chat. So maybe I'll just end with a quick one, which is, Women in Global Health Georgia. I know over this year, this topic is a key area of interest for us. And so we're going to be continuing to have conversations and would love to continue connecting with the two of you, especially as we move into the session. But what other groups, what other coalitions can we be plugging into? We know that we cannot do this work alone and should not. There are other good, strong coalitions and partners that are at the Capitol that are already doing this kind of work. So who else should we be looking to?
I would say on the childcare front, Gears is a really strong organization, and they have folks at the Capitol every day. They've got great fact sheets. They host events. They are really on the front line with legislative ideas and issues. On the senior side of the House, the Aging Coalition also has a really strong group that is at the Capitol and has a legislative strategy. I'm sure we can get the links to those to y'all post meeting. Those are two that are well established, have really good resourcing already, and would love, I'm sure, all additional and welcome folks to join on and to help the work that they're doing.
And if I could just give some very practical advice, go ahead and follow those groups on social media to keep up with what they're doing during the legislative session. Sign up for Representative Campbell's and my newsletters as we
Yes.
try and move these things forward. We will be talking and follow us on social media. We'll be talking about these things on social media and we'll be talking about them in the newsletters. As Representative Campbell mentioned, a lot of times these dates and these meeting times change at the flip of a dime. So sometimes social media really is the best way to keep up with those things. The other last thing that you can do if you are really committed is we can give you the names of the committees that are most likely to consider these pieces of legislation, and anybody can reach out to the committee and say, I would like to receive all your meeting updates. So anytime that committee meets, you will get an update from the committee about what is on the agenda, what bills are on the agenda, and the time at which they will be heard.
It's a great point, and everyone should know they can, if they can't make it in person, every single legislative session, every single committee and subcommittee are live streamed. They're also recorded, and you can watch the archived videos at any time. And those are really beneficial to kind of understand the questions that legislators ask in advance of coming to speak, to get a sense of where somebody is in terms of their point of view on a particular piece of legislation. It's not always it's not always obvious what the topics are. Sometimes you have to do a little bit of research, but everything is available and there is a search functionality. Not all of the bills are named appropriately. I'll just say that. So sometimes they're a little bit tough to find, and sometimes they're a little bit deceptive, honestly, in terms of how they're labeled. So
Yeah, really helpful notes. Thank you guys so much for all your contributions to these conversations, but also your help kind of demystifying the whole process and how our folks can be involved and can learn more. We really appreciate your time and all your thoughtful contributions to this discussion. And now I'm going to turn it over to my colleague, Suba.
Hi, everyone. I just want to do a really quick closing. Thank you all for being so engaged and energized. Thank you to the representatives for being here, talking about, policy and policy at the state level. We've taken all of your questions, ones that we didn't answer as well, and we'll be able to try to connect you all with the resources that people put in the chat as well. Join our group. We're hoping the rest of the year that we talk about this topic broadly and specifically, and we're really hopeful that you all can shape the conversation. Thank you all.
Thanks,
Thank you
everybody,
so
so much.
much.
That concludes our webinar.
Have a great afternoon.
Bye-bye.
Well, thank you so much. That was a great discussion.
Yeah, I think we should stop the recording maybe. And sorry, the last thing I was going to say is I think people are signing off, but we'll try to, there's a few people who are researchers in the chat that focus on caregiving. So make sure to get you connected with those people too for the data.
That would be wonderful.
Yep.
Thank you so much for hosting. This was really fun, and I'm so excited to stay connected.
Awesome. Thank you.
Have a good afternoon.
Bye.
Bye. Oh, sorry, Maria. Is everyone off? Or Katie?
I'm about to hop off.
Oh,
and I'll
I
end
just
it.
want to save the webinar, the chat. Is there a way we can save the chat?
I think it's supposed. Who can see your messages on my recording? I think it is supposed to be part of the. I think it's supposed to be part of the. Oh my gosh, what is it? The recording in itself. Because
Okay.
I think when you record, I know this is on Otter. It usually saves the. I haven't used Zoom. We're in between Teams and Zoom, but.
All right.
If not.
Okay, I'm gonna the only thing I think we need to do is make sure people have access to GEARS, GA, GCOA. I'm gonna take that information and then I'll connect the representatives with Regina Shi. So,
Okay.
okay, thank you.
Thank you.
Bye.
Sorry, I'm still like, I'm talking to Maria.
Do you want me to end the webinar?
Yeah, I
Yeah,
think we
but quick
can.
question.
I got it. 3,
Oh,
2,
wait,
1. I
second.
can end or no?
Oh, 1 second. Do you think they save does it save the chat?
It should.
Okay. I'm just gonna take down gears and GCOA.
It says it's recording messages, but yeah.
Okay, cool. Okay.
Ready to go?
Yeah.
Thanks.